Let's call order the Health Committee for 10 a.m. I'd like to start with the invocation, and I've asked Councilor Soap to give the invocation, please.
Dear Father, Lord, creator of all things, we just come to you this morning, Lord, and we just pray that you will bless our nation, Lord, just bless our people, and just bless our employees, Lord. I just pray that you will give us health, give us wisdom, give us knowledge, Lord, to make the right decisions. Just be with those that need you at this moment, Lord. Just pray that you will put your healing hand on them, Lord. Just give us loving hearts and fill our lives with joy, Lord, to focus on you. In Jesus' name, amen.
Next is roll call.
Brad Cobb.
Me.
Janelle Fulbright. Bill Anglin.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzer.
Here.
Julia Coates. Here. Joe Crittenden. Jody Fishinghawk. Here. Meredith Fraley. Don Garvin.
Honey.
Chuck Hoskin Jr.
I'm sorry.
Tanya Glory Jordan.
Present.
Curtis Snell.
Here.
Chris Soap.
Ronnie.
David Thornton.
Present.
Carol Watt.
Honey.
Mr. Baker.
Chuck Hoskin Jr. sent a letter. Regrettably, he must resign from the Health Committee effective immediately, and I move that we accept his resignation.
We have a motion and a second to accept Chuck Hoskin's resignation from the Health Committee. So we need to vote on this. All those in favor?
Mr. Chairman,
Aye.
Yes, Mr. Garvin.
is there a problem that he's not being able to serve Cherokee Nation?
Says here that the resignation is due to unavoidable reoccurring professional scheduling conflicts. Rest assured that the policy areas within each committee jurisdiction remain important to me. In that regard, I request the council staff send me all committee information sent to committee members. Second, assume that I am free to rejoin either committee at any time during the term, and look forward to appearing at committee meetings from time to time to observe or present legislation. That was the explanation that he gave.
I think his input would be welcome, but he has other fish to fry, and I understand. Thank you.
Any more discussion on the letter as read? We've got a motion and a second. All those in favor of accepting the resignation of Chuck Hoskin from the Health Committee, say aye.
Aye.
Any opposed, please? Motion carries. Next on the agenda is the approval of the September 11th minutes. I move to be approved.
Second.
All those in favor of approving the September 11th minutes, say aye.
Aye.
Any opposed? Motion carries. We're on to reports. Claremore Service Unit, Mr. Jim Custom, please.
OCO. This is my first time in front of this new committee, and very well pleased to be able to come before you again, and I wish you well in your activities this year, and I'll go ahead and go into my report. Dr. Likes has been selected a new dental chief, and he began his tour yesterday with new employee orientation, and we had 11 new employees. We are presently changing our financial management system, and we go live with the unified financial management system on this Thursday. It should be a very interesting transition. I would expect that we'll have a few hiccups, but we will be able to do business as usual. Right now we're in a blackout period and not able to buy anything, and we've ordered our supplies, stockpiled our supplies, and are working through that system. We're in our combined federal campaign activities right now, and so far they haven't asked me to kiss any pigs. We'll have a drive-through flu shot clinic on October 22nd and and October 26th. Through that period of time, be in the parking lot, Expo parking lot next to our facility. Our electronic health record has been operating smoothly, and we're going to be a test site for a new pharmacy patch of 1.0. Speaking of our pharmacy, in our pharmacy we have a new couple of pieces of equipment, Parada drug dispensing robot that does capping and doesn't ask much for overtime, and works around the clock. And we have some Acumate cabinets and that should make our operation more efficient. As far as our EHR, we have 3 CACs, clinical application coordinators, Marty Smith, Lola Kane, and Mary Jones. Mary's in the lab, Lola does pharmacy and providers, and our main coordinator for the EHR is Marty Smith, and has done a real good job. We now have a full staff again in our diabetes program. Our workload is slipped downward in comparison to our 2006 statistics, and that is in regard to probably lack of providers in our OB department, and I'm in the process of doing a business plan for that particular department, and I'm in my 4th revision, and hopefully we'll have that going soon and we can restaff the department. We had 3 national IHS awards. Our EHR team was recognized. Dr. Zarella, a physician, was recognized for the National Directors Award, and our congestive heart failure team. And Dr. Martinez will be going to Washington, D.C. to accept that. On the GIPRA awards, Government's Result Performance Act awards, we had 3 awards, and we were also awarded the Best Overall GIPRA award for the area, so we're proud of that. Our PCC data is backlogged 3 days, which is acceptable because the 4 days is the benchmark, and we're under the benchmark. Third-party collections, we had a goal to increase our collection by 3%. We fell short of that by $200,000, roughly speaking, and we'll work harder next year to meet our goal. We're going to look at our charge master, our electronic charge master, to see how we can make that more beneficial and to aid us in our efficiency. And in our CHS activity, we are re-advertising for the CHS director's position, and we have also 2 tech positions that we're trying to fill. Our budget, we finished this last fiscal year in the black, and very proud of that, and we did well in the management of our supplies. Any questions?
Any questions from Mr. Guthrie? I've got one. I'm looking at your pie chart on the diabetes, and you said that your numbers had gone down basically because of staffing issues. Is that correct? Right. Did you say in obstetrics?
No, I said, well, yeah. I mean, in our productivity has gone down in OB-GYN because we're running short staff, and we're in a holding pattern right now, but until I do the business plan. Okay. And then once I get that, then we'll be able to hire our OB-GYN physicians, and our productivity should be back up.
Okay. Thank you.
Thank you.
Next on the agenda is Ed McElmore from Hastings.
Good morning, everybody. I appreciate the opportunity to present some information to you on the operations at Hastings. I did provide a handout, except kind of a purple covered document, status report, October 16th. The first sheet is our fund status report as of September 30th. If you look over the right-hand column, about 2/3 of the way down, there's a $56 million line item there as was total obligations, and we have a balance as of September 30th of $1.5 million. We ended the year with about a $1.5 million carryover to start up the next fiscal year. That includes money to cover the first quarter of operations with supplies and that sort of thing to keep us in business during this startup of the next fiscal year, the current fiscal year, 08. We are on a continuing resolution through November the 16th. The Congress, for whatever reason, was unable to arrive at an agreement on an annual budget for the federal government, so we're funded through November the 16th at whatever pro rata amount that comes out to be for that period. There are some other items in here that you can look over at your convenience. We did identify a couple of typos that you probably will come across too. On November the 6th through the 9th, we're going to have a drive-through flu clinic at Hastings out in the parking lot. We did this last year, and we ran folks through at a rate of about 1 a minute, as it turns out. I don't know if that really sounded right, but the rate of access to that clinic was about 1 a minute. Right through, and we're going to do that again. I mean, it was very well, it was a very successful effort. That'll be November 6th through the 9th, and of course you all are welcome to participate as well. Some of the statistics for 2007 for Hastings: we had 95 babies delivered at Hastings in September. We are on pace for nearly 1,000 for this calendar year. We are looking through December. It's a very active component up there. Patient encounters, we estimate at just short of 250,000 patient encounters at Hastings for this past fiscal year. Those numbers are not yet in. That's a whole lot of activity up there. Prescriptions, we're looking at about 317,000 prescriptions. Our high was about 1,800 in one day. Prescriptions being filled. A lot of activity. And our waiting times are pretty short. I don't know if any of you all have access to Hastings in the adult walk-in. You can walk in, be seen by a provider, get your pharmacy consult, and then by the time generally you get up into the dispensing area, your prescription, your order is waiting for you. I don't know if you've had that experience, but I know a lot of folks have. And if you're running into problems or you hear about problems with that process up there, I'd like to hear about them also, because I think that's what our whole effort is aimed at, is fixing those problems, particularly waiting times for patients. Collections, we were very successful last year. We collected $33.5 million from private insurance, Medicaid, Medicare. Medicaid was our big payer, about $15.5 million we collected. Private insurance, just under $10 million we collected. That's a good indication of people's perception of the quality and level of service they're receiving at Hastings. Whether that's valid or not, it is at least a perception that they're getting quality care, and we think they are, and apparently they think they are, because they're bringing the resources into Hastings for those services. Our total operations budget, if you look at the $56 million amount expended plus the carryover, our total operations budget was $57.6 million in FY07. We have an IHS award ceremony coming up December the 12th in Rockville. We have 4 awardees, 2 groups and 2 individuals. And also on November the 15th, all council members, health committee members are invited to Hastings for our annual internal in-house Thanksgiving dinner. It is a big event for us. We start serving at about 11. If you'd like to come up, we'd certainly like to have you. Mr. Chairman, I'd like to answer any questions.
Is there any questions? Mr. Buzzer?
You said your collection was $33.5 million. Do you have an idea of what maybe you collected last year? I know that
we collected $28.627409 last year. And 33 cents.
That's great. So you increased several $1 million.
We increased about $4.2 million. Yeah. It did. And as Speaker Fraley indicated, sometimes we do show red ink on our status report, but invariably at the end of the year we must show black in all accounts in all categories. And we were successful in doing that again.
Thank you.
He said his color printer broke.
Are there any more questions? Thank you very much. Next, we have Cherokee Nation Health Services, Melissa Gower.
Good morning. Good morning. I almost said good afternoon. I was used to having health committee in the afternoon. I submitted my report, and so hopefully you've all been able to look at that. Just 2 special announcements that were in there that I wanted to highlight. We did have Marge Burton, who is our Privacy and Compliance Officer, is a recipient of the National IHS Directors Award. So that says something very good about our staff. And secondly, Cherokee Nation received 15 Government Performance Result Act awards for best and most improved at the annual conference this year on various indicators. Jim and I were just in a contest. He said, well, we received 3. And I said, yeah, but we received 15.
But we got best overall.
But we got 15. So we're excited about that. And then just a couple of announcements on the 2 new physicians, Dr. Lisa Ortiz at Redbird Smith and Dr. Clinton Childs at Salina, that's been filling in at Jay. And then the other thing I have is that I promised to bring back a sheet that showed the $3 million in travel CHS dollars. So here is the worksheet that I did. And if anyone has any questions on my report, I'll be glad to try to answer those.
Any questions for Ms. Gower? Mr. Buzzer?
Melissa, I have one. It's with our insurance billing. Do you have any indication what we had this year versus last year?
Yeah, it's in the report that I sent you, the very last chart.
Okay.
We collected $16 million this year, and last year we collected $13 million.
Okay.
Thank you.
Thank you.
Thank you very much. Yes, Mr. McElroy.
Mr. Chairman, I omitted one item I would like to bring to your attention. It's on page 11 of our handout. We have a distinguished visitor, actually a distinguished guest at Hastings. He's the former director of the Indian Health Service who's opted to forego a second appointment, second term as the director of the Indian Health Service. Dr. Charles Grimm has been assigned to serve as the Director of Policy Review. He will be something of a liaison between the agency, the Department of Health and Human Services, and the Office of the President, the White House. And we're honored to have him stationed at Hastings, and he's going to work on a number of projects, and but still maintain those national requirements and duties. But that's another item for your information.
Thank you.
Robert McSwain is the acting director now.
Mr. Chair, I had one more question of Melissa. Where are we on the land that we bought behind the Hastings Hospital? I know you had a guy in here to do some planning for you. Where is that? What's the status on that?
The status on the planning of the
Yeah,
land?
the planning and, yeah.
Well, we do have a master plan developed for it, and I've been working with Todd Enlow to get all of that on the capital improvement plan.
Okay.
And so it's in the process. He's actually, Todd has actually hired an architect part-time this fiscal year to come in and actually plan that out architecturally.
Okay. Just one bit more. And if you haven't, when there's a roads program, that needs to be brought up to Michael Ann over in the roads to make sure we improve that road going up Broad Street there too. Okay. Thank you.
Any other questions? Next, old business. Doesn't seem to be any old business. And any new business, please? No new business. Any announcements? I'm sorry? I can't hear you at all. Where? Right out here. Oh, we have an announcement. We have flu shots at 12:30 right here. So roll your sleeves up. Next is adjournment. I need a motion to adjourn, please. All those in favor of adjourning, say aye. Any opposed? Hey, that's up to Gail. I'll leave that up to you and Gail, man.